So good morning. Today we're going to be starting the health and social care sector within healthcare for level 3. Now this health and social care sector unit actually has 3 learning outcomes, so it's not a long one. Now I'm going to go over the learning outcomes in a moment, but I'm just going to do a quick reminder of the grading structure here, because we've got a pass, merit or distinction. Now this is more for the learners that have started new, so I apologize if you've heard me say this many times. So because we've got 3 sections of a grading structure here, you can choose to go for a pass, a merit or a distinction. Now I always like to explain this so you know exactly where you are when you're doing your work. If you just want to go for the pass qualification for the whole course, then just only answer the pass column questions, which are, I'll annotate this, it's my highlighter, which is this one here. If you want to go for the merit, you're going to do all of your pass and all of your merits. And if you want to do your distinction, you have to do all of your passes, all of your merits, and all of your distinctions. Now you'll notice that not every section has a merit or not every section has a distinction. So if there's not one there, that's fantastic. It means a little bit less work for you. Now the 3 learning outcomes that we're going to be looking at over the next few days. The first one, which we're looking at today, is understand the organizational structure of the health and social care sector. Learning outcome 2 is investigate how current legislation and professional codes of practice impact on health and social care provision. And then learning outcome 3 is understand the importance of multidisciplinary working in health and social care. Now, multidisciplinary, you might know it more as partnership working, where you're working with other services. And we scroll down on this specification sheet, which you've all got access to. I've emailed it to you when I sent you the summary schedule, and also it's on Moodle. If you need a bit of a reminder of where things are, I'll be happy to show you at the end. Scroll down towards the indicative content, and it just shows you exactly what you need to add. So the first 3 bullet points will cover 1.1. The 4th bullet point will cover 1.2. The 5th bullet point covers 1.3. The 6th bullet point covers 1.4. And then the last bullet point, the one that says requirements, covers 1M1. So if everyone's okay, should we make a start?
Yeah.
Fantastic. Brilliant. And please remember, don't be shy to ask anything. If there's something that you're not sure about, it's most likely that somebody else isn't either. So don't be afraid to ask. So the aim of this unit is to develop your understanding of the structure of the health and social care sector, how the legislation and codes of practice impact on provision, and the importance of multidisciplinary working, so team working with different partnerships. So this first section here, it just shows you, it's giving you a couple of images on the overall structure of the health and social care sector. Hi.
Yeah, this is Ganiat. Am I in this class?
Yes, Ganiat, you are, because I don't think you've had health and social care sector yet.
No, I've not.
Yeah, so yeah, you're with us.
Okay.
Fantastic. And we've also had Addy join. Good morning, Addy.
Good morning. Yeah. Sorry I joined late. I'm sorry.
Oh, it's okay.
Yeah,
You've not actually missed anything. We've just started, so you're right on time for us.
All right, thank you.
So we're just going over the very first section. So for 1.1 in the health and social care sector, these 2 images, they actually just show 2 different structures within NHS. The first one is a structure in England, and the second one is a structure for the healthcare system from 2013. Now, when you're answering your questions, I always suggest for 1.1, include one of these images in. But again, I will explain everything very clearly when we're doing assignment day, and I'll show you what to do. So this second bit here, we're going to be looking at the role of the Department of the Health in the new system. So the Department of Health's aim is to help people live a better life and to live longer. So they want to make sure that they shape, lead and fund the healthcare within England. So this actually came about so that residents of England get the support that they actually need, to get an adequate support. And this actually ensures that people have the support, care and treatment that they need, and that they're dealt with compassion, respect and the dignity they deserve. So again, this comes very well into equality and diversity. Everything really aims off that. You'll learn a lot more about this when you go into the person-centered approach, or for the students who have already done that, you'll see the similarities. So the common purpose of the department is to create a good working system where different organizations work together. So within this, you'd have health and social care sectors, you'd have schools, police, social services, so different sectors just trying to work together with each other. Now, by doing this, it helps the health and social care bodies, so the services, to deliver a better service. They help them to work together, set objectives, have a better budget, and then also it really holds the Secretary of State into account as well, because they know that there's something being done legally here, it's being worked towards. Now, the Secretary of State has the ultimate responsibility to make sure that every organization within this whole system works together and, meets the needs of the patients. So they're the people that are in charge overall. Now, on here, you can see the overview of the health and social care structures within the Health and Social Care Act of 2012. Now, you've got the public health over here, you've got which is here, you've got the NHS over here, and then you get the adult social care over here. And it just shows you what they do on a national level and a local level. So local level, think about the city that you're in. So Manchester, Liverpool, Birmingham, wherever you are, just think about that is the local level. So what services are being offered locally? And then national level, just think overall the districts that you're in. So if you're in Lancashire, you're in Greater Manchester. So that's how we work off that. Is everyone okay so far?
Yeah.
Fantastic. So let's move on. Now, on the following section, we're just going to look at, over the following 3-4 slides, we're just going to look at some of the responsibilities that are covered by the Health and Social Care Act of 2012. So, from here, from the point of view of the patients and the public, you need to make sure that you've got access to NHS services on the basis of need. So we don't have a system here where we have to go and see a doctor and pay for every single thing we do. We're not a system like in some countries in Pakistan or India where you're actually having to pay for every visit you do. Over here, we're very lucky and we're very privileged to have the NHS. So we can go, we're feeling unwell, we've got a bit of a cold or a flu, we've got body aches, we can go and see, get ourselves seen. But in other countries, what will happen is people leave their appointments or their care or, their needs right to the last minute because they're having to pay for so much and it's very expensive. So what happens over there? Yeah, exactly. So you'll notice a lot more people over there that will be leave it right to the last minute and make themselves so ill before they go in. So really, I have the utmost respect for the NHS here and every single person that works within it. We are extremely lucky that we have this service. So at a local level, local authorities have a strong role in shaping the services. So, within a particular area, if you've got a high minority of a particular culture, then, maybe if one minority is adept to having diabetes, then you're going to have that focused a lot more. Healthcare, making sure that you're managing your food, trying to avoid, keep yourself healthy and so on. So things will get shaped depending on what area you live in and what the needs of that area are. Now, we also have new health and well-being boards, and these bring together local commissioners of health and social care. They have representatives, and they also have representatives of Health Watch. And all of these people, it's like a board of members. What they do is they'll agree to an integrated way, so they'll work together and they'll agree to ways to improve the local health and well-being. So most of the NHS care is going to be commissioned by the clinical commissioning groups. So this gives GPs and other clinicians responsibility for using the resources that they have and to actually give high quality services. Now, the NHS commissioners are supported by a new body called the NHS Commissioning Board. Now, this board authorizes clinical commissioning groups. It gives resources, it gives services, things like primary care, and it will also host like social networks, like clinical networks, where it will get together and they'll advise on if there's a particular area that needs to be looked after in a particular area that you're in. Now, the NHS providers no longer have their performance managed by the strategic health authorities. They've got a system of regulators, which we will go into at 1.3 here. So they've got the Care Quality Commission. Now, the Care Quality Commission is there to make sure that your safety and quality requirements are met. Now, the easiest way that I can explain this, if you've ever been into school or got children in school, or know of some children in school, you know that the schools get regularly monitored by a company called Ofsted. They're a regulator. They make sure that the school is running the way it should, that the children are getting taught, that the staff are teaching the way they should, that the rules are being followed. Now, the CQC, Care Quality Commission, is the same thing for schools as Ofsted is. So CQC is that for all healthcare providers. They'll come in, make sure that you're doing what you need to do. If you're not doing it, they'll set you steps and implement things. If in the end they can't make sure that you're failing to meet all the requirements, they might even shut you down. So what we're doing on here, you're going to monitor, will temporarily also retain oversight of foundation trusts. So we've got the NHS Trust Development Authority, but this is not the Act. It's not within the Act over here. So they help any NHS trusts to achieve foundation status. Then we've got the Health Education England, and these actually provide an oversight and leadership for professional education and training. Now, you know, if you're working within healthcare, that training, CPD, continuous professional development, all of this is very important within your work. If you decide to go into nursing in the future, which I know a few of you are hoping to do, it's actually mandatory that you do 30 hours per year training, and it is very doable. So training is an enormous factor when you're working. Now, the National Institute for Health and Care Excellence will also continue to provide independent advice and guidance to the NHS, and it will also give advice and guidance to the social care sector as well now. Now, the Information Centre will also continue to act as the central authoritative service of health and social care information. So the National Institute is where you can get guidance, advice, and information. Then the last slide for 1.1, we come on to the ministers for the Department of Health. So they're actually ultimately accountable for the NHS, but they don't actually directly manage the providers. They sit there, they're transparent, they set objectives for the NHS, and they put mandates through for the NHS Commissioning Board. Overall, even though they're not physically running the NHS, they're in charge of making sure that the targets and objectives are being met. So it holds on to account all of the national bodies, and it has the power to intervene if there's a significant failure or if there's an emergency within a sector or within a certain setting. They also set about action to protect and promote the health of the population, and it needs to be led nationally by a new public health service. So which is a Public Health England, and it's an agency within this department that looks after that predominantly. So anybody got any questions for this section?
Yes. Excuse me.
Yes.
Placidia. The slide before this one.
Yeah.
That's, I think, 8. Yes. The monitor will temporarily also retain oversight. I didn't understand what that.
That is just carrying on from the Care Quality Commission. So on here, on slide 7, it says that the Care Quality Commission actually monitor and promote efficiency. So we're just talking about the Care Quality Commission here. I will change this and put CQC on here. So it will just be CQC will monitor and also temporarily have oversight of the foundation trust. If there's an issue, they're going to take over and they're going to give you targets and monitor, make sure that you're actually working towards what they told you to do.
Okay.
Is that okay?
Yeah.
So we're going to go into 1.2, and this is explain the role of health and care regulators and watchdogs. So on this, we're just going to look at different regulators, different watchdogs. Now, what are regulators? So I'll just read through this little top section here. Regulation plays a major role in the healthcare industry and healthcare insurance coverage. The various regulatory bodies protect the public from a number of health risks and provide numerous programs for public health and welfare. Now, all of these regulatory agencies, which we're going to go over who they are exactly, they'll regulate public health at every single level. So it might be at a basic level from just a GP, or it might be at a specialist clinic. They're going to make sure and keep an eye on everything. So we've got what organisation inspects and regulates the health and social care industry. So as we spoke about a moment ago, the CQC. So the Care Quality Commission was established in 2009, and it's an independent health and social care regulator. They're not paid by the government. They've not got any interest in following what the government wants. They're there to make sure that everything is done the way it needs to be done, completely independent. So they're responsible for the registration of all of all clinicians, the regulation of them, the inspection of them, and then it gives you a rating. So if you were to go into a hotel and somebody was to come in and you've got a 4-star hotel, so that's a rating, or a 5-star hotel, or 2-star. This is the same sort of system. It might not work as 2, 3, 4, or 5 stars, but they give a rating of what the providers are doing and what level of standard they're at. So over the next 3 or 4 slides, we're just going to look at who the health and social care regulators are. So there's 12 health and social care regulators. Now, we've got the General Chiropractic Council, called the GCC, and they regulate chiropractors. Then you've got the General Dental Council, GDC, and they regulate dentists, dental therapists, anything to do with the dentists, anybody working within that. Then you've got the General Medical Council, they regulate doctors. General Optical Council, which regulate opticians, optometrists, and so on. Then you've got the General Osteopathic Council, which regulates osteopaths. Then you've got the Health and Care Professionals Council, so HCPC, so it's for short. So they regulate quite a number of people here. So in a way, the specialists, so art therapists, biomedical students, podiatrists, physiotherapists, paramedics, psychologists, radiographers, social workers in England, speech and language therapists. So their list is quite extensive. They've got a very big umbrella which they focus on. Then you've got the Nursing and Midwifery Council, NMC. So they regulate nurses, midwives, and community public health nurses. And then you've got the General Pharmaceutical Council, and they regulate pharmacists, pharmacy technicians, and even the premises that the pharmacy is on. So if you go into Boots and there's a pharmacy within the shop, the General Pharmaceutical Council will regulate those. Then, like I said, it's an extensive list. You've got the Pharmaceutical Society of Northern Ireland. So they do pharmacists and the pharmacy premises in Northern Ireland. Then you've got the Northern Ireland Social Care Council. They do the social care workforce in Northern Ireland only. So you've got Social Care Wales, and again, it's just for Wales social care workers within them. And then you've got the Scottish Social Services Council, and they're responsible for registering people who work in social services in Scotland only. So this section here, when you have a moment, please go back into the slide and read through this. Now, I'm not going to read through every single little thing on here, but I will point out. So this is just a leaflet on regulation and monitoring. So I will just point out a few things. Up at the top section here, we've got something called revalidation. Now, revalidation, this is what clinician needs to do to demonstrate to regulators that they're fit to practice. So they're going in, they're doing they keep making sure that they've got their training, that they're up to date, that they're providing the services that are up to date and current. So that's what they need to do and make sure that they're revalidated. Now we've got a little section on here about the General Medical Council, just to point one out. So this is an independent regulator. It sets the standards that are required for doctors practicing in the UK. It decides which doctors are qualified to work in the UK or the overseas, depending on their education and training. And it ensures that doctors continue to meet these standards. So it's nice, it's got a section for each little bit. There's one for Nursing and Midwifery Council here, the Dental Health Watch Care Quality Commission. So it's nice to get a little bit of extra information here. So that was 1.2. Do you have any questions in regard to that? Okay, if everyone's okay, I'll pop on to 1.3. Now, this section here, we're just going to look at, I'll read the question actually first. So 1.3, explain the roles and responsibilities of staff in the structure of a named health and social care organisation. Now, this section, we're just going to look at the roles and responsibilities for different organisations. You know, what they do, why they do it. Now, this is a couple of slides here, but towards the end of the lesson, I've got a few more details to pass with you as well. So we're looking at social services, NSPCC, health visitors, GPs, probation, police, probably education, so schools on here, and then psychologists. Now, some of these are going to be, like I said, covered towards the end of the presentation, but we'll look at social services and GPs to start off with, what they are. So we just put basic key descriptions of what they do. Obviously, if you're more familiar with these services, you're very welcome to input information and let us all know. So the social services are there to provide support for vulnerable children. They're responsible for coordinating and implementing interagency child protection plans. Safeguarding is a very big thing within the social services. There to ultimately make sure that children or vulnerable people are being safeguarded. They're there to make inquiries. So if there's ever been an issue about safeguarding or about a person's welfare, they'll step in and they'll make inquiries. They're going to deal with courts. So if they find somebody is in immediate danger, they're going to liaise with the court, and the social services really do try to keep the child or the young person with their family as much as possible, but there are some instances where it's not possible and it's not safe for that to happen. So in that case, they might remove that vulnerable person from their immediate setting. Now, they're the principal point of contact for child protection concerns. They're responsible for coordinating assessment of persons' needs, and they also put arrangements into place where they can get in touch with parents or family members or agencies where you can actually get in touch with them if there's an issue. Now, GPs. So GPs are there, again, ultimately they're there to look after your health needs and also to safeguard where necessary, their job to watch. So they know when and how to refer a child or a young person to social services. So if they've come in and they've seen somebody that's constantly coming in with broken bones or constantly having bruises or constantly becoming ill, maybe due to neglect or not wearing the right type of clothing, they will point that out to the social services and get them to just have a quick look into it. They're going to be informed immediately when other members of the primary healthcare team become concerned about the welfare of a child. Now, even on GPs here, if you've ever taken your child to the hospital, you know, a couple of weeks later, you'll end up getting a letter saying that, you know, your child, say their name and it'll have a little summary of what was done at the hospital. So things really are liaised over here. They'll discuss their concerns with colleagues. So they might have a safeguarding person within each setting, somebody who's there to be a protection officer or somebody who's there that's experienced in these matters and can actually ultimately take over them. They'll share information with social services. They'll attend child protection meetings where necessary. And then as an employer, GPs are also responsible for the staff. So anybody that's working with them there, and they need to make sure that their staff are given child protection training. So from their receptionist to their physician, they need to make sure that everybody that will come into contact with a patient is experienced in how to identify certain things. So that's it for 1.3. Like I said, I'll be going over a few different services like police and school right at the end. Is there any other questions you'd like to ask about this? Okay, so I will work on to the merit question now. So this section is about CPD. So 1 explain the continuing professional development needed for progression through different career pathways. So CPD is continual professional development. And how does this help you to progress in your learning? Now, even now, I'm constantly doing CPD activities. There's a bit of training that I'll do. I'll read a book. I'll go on YouTube, you know, watch a video or read an article. So depending on whatever type of field you're in, there's always something that you're doing just to keep up to date or even just to learn a little bit more. So CPD is a process of developing professional skills. So you're gaining knowledge through interactive, participation-based or independent learning. So you might be going into lessons, you might be doing conferences, you might be just looking on the internet. So it helps the learners to proactively develop their professional capabilities, and then you get certified learning or self-guided learning. So certified learning is where you end up getting a certificate or a diploma at the end. And then self-guided learning is where you're just researching a book, an article, speaking to someone. You might even have a good conversation with somebody that you work with. Even that is CPD. So why is continual professional development integral to the role of health and social care practitioners? So it's really important in any field, but especially within healthcare, because you're doing a whole load of different services, little procedures, things. There's so many things that you're expected to do. It's really important that you keep up to date and you are aware of what the changes are, of what you need to do. So it's important because it delivers benefits to the individual, your profession, and also to the public, because your customers, they are the public. So any member of the public is your customer. They're not coming in to choose to buy an Apple phone or anything. They're coming in because they're not feeling well. So anybody could potentially be your customer. So CPD ensures that you maintain and enhance the knowledge and the skills you need to deliver a professional service to your customers, your clients, so your service users, and also to the community. So when you go on this, we're just going to look at, before I start on this little section, for CPD, can anybody let me know what interactive learning is? just a bit of an idea of or a point. So what is interactive learning? I'm going to start picking on you if I don't get an answer. So let's see who I've got. Nancy, are you here? Fantastic. Can you tell me what interactive learning is? Just think about interactive.
This section we are having could be, I can use it as one of the examples of interactive learning, because we are interacting in a situation whereby the floor is open for anyone to ask questions, and then on the process of asking questions, we are interacting, and then when the question is being thrown, and then when the answer is being given, everyone would, learn from the question and then from the answer that was given.
That's very good. Well done, Nancy. That is exactly what I was looking for. So you're questioning, you're discussing, you're challenging, if there's a bit of information that I give you and you think, oh no, that's not right, you might be clarifying or you might be correcting it. So all of these things, when we're discussing with each other, are interactive learning. Now, this section on here is the CPD progression and career pathway in the health and social care sector. Now, to give you a bit of a pointer, when you go on to answering 1M1, you're going to actually talk about your own pathway. You're going to talk about how you are progressing. So I'm not thinking about what people do in general. You'd want to include this image in there. And again, I'll explain when we're doing the assignment. I'll go over this again. So you'll want to include an image like this, even this one here. And then you just want to explain in a nice amount of detail what your pathway is, what are you aiming to go towards, and what you're doing to go towards it. So it's not as difficult or as concerning as it looks. It's quite nice, simple answers for these sections.
Okay. Excuse me, it's Placidia.
Yes. Hi, Placidia.
Was supposed to drop out everything we're saying right now, or pick a particular pathway and explain it and drop it out?
Pick your pathway.
Okay, pick your pathway.
Pick what you want to do, because you already know exactly what you're going to do in it. You already know what steps you started to do with it. So, for example, a popular pathway for my students is to go to university into nursing. So a lot of my students will do level 2 English and maths. They'll do this level 3 healthcare course. So that's already, with that, you might have done some previous courses earlier. Then you would say my pathway is that I'm going to be applying to university and doing this course, going to get a degree in this. And then after that, I want to do this many years experience or voluntary work. And then you just explain for the next 5 years, in a way, how you're going to get from where you are, what you've already started doing, and how you're going to get to where you want to be. So just talk about yourself, give a nice amount of information. So include this image and about 2 nice detailed paragraphs, and it covers you. So your answer is not wrong. If you're doing a particular path, if you're wanting to go into medicine, or you wanting to become a care worker, whatever it is, you want to go into management, you might want to do the level 4 course next. So just talk about exactly what it is you want to do and why you're doing it, and what your aim is. And then if any of you have trouble snipping these images out, I'll email these. I'll make a little document with all these images, and that you can just copy and paste in.
Yeah, please.
Yeah, that's no problem.
Thanks.
So we've got continuous professional development. Now, I love CPD, and I know I'm probably a bit of a nerd, and I do, whenever I talk to anything to do with CPD, it really makes me happy, because it's you progressing yourself. All of you that are on this course, you are working towards yourself. You're training and developing yourself. You're making yourself go towards a target. And I'm very proud that all of you are here and that you're working hard to go towards your goals. It really makes me happy when people want to achieve the goals that they've set out to. So with CPD, it's actually written into the NHS Constitution that you need to invest, that you need to have some training and development as part of it. So even if you're full-time or part-time, you need to have something that there. You might have had just, from where you're working now, you might have just had the odd training courses where you're learning first aid, or you might have had some talks with a managed person who's a bit more experienced than you. You might have just shadowed them and seen how they're doing particular tasks. All of this is CPD. All of this is you learning how to do something. So it's not physically you just sitting down and reading things or completing courses. It can you be watching as well. So CPD is good news for everyone. So all NHS staff complete annual development reviews and create personal development plans. So it gives you the opportunity to learn new skills, and it also helps you to take on new responsibilities and maybe even go into a new specialism. And then all nurses and midwives, just as an example, need to complete, I said 30 hours before, but it's 35. So they have to have 35 hours of CPD. So this is to make sure that you comply with the National Nursing and Midwifery Council. And again, all doctors need to complete a certain amount of hours of CPD as well to make sure that they keep their registration. Now, for me, within my teaching profession, with the organisation that I'm registered with, I need to complete 50 hours of CPD per year to maintain my registration. So this little things here and there do count, and it's very easy and very easily done if you start counting everything into it. A video you've watched, a conversation you've had, you might have just seen somebody do a particular thing. Everything is you learning. So again, what counts as CPD? On here, I'm not going to read through every single little thing with you, but what counts as CPD is observations. Like I said, I might come into work now and I might see Athe working, and I might be told, oh, Afsha, go and shadow Athe today. You're going to see what sort she does, what sort of procedures she does, what her patient care is like. So those 3 or 4 hours that I spend with her will be me working on my CPD, because I'm learning, I'm watching her. She's doing her work, but I'm actually learning how she does it, the processes, the techniques, what sort of way she works, and that's me getting 3 or 4 hours of CPD just there in that section. So you might want to do courses. You might want to read some articles or books or leaflets. You might want to look at some reviews. You might do assessments, or appraisals. You might have somebody, one of your management, coming in and assessing how you're working. They might come and appraise you, do a yearly appraisal. So all of this is CPD. You might have discussions, so speak to someone, and you might even look at webinars or just join an online webinar where someone is talking and you're just listening. So even that, if it's a 3-hour webinar, you've got 3 hours there again. So automatically you've got logged so many hours without even realizing it. So CPD doesn't have to be formal. It's not you paying for a course and you saying, right, I've spent £150 to do this course this year, and I have to spend £300 more to do another course. It's not something that you have to go and pay for unless you absolutely necessarily want to do a particular specialist course. Now, it can be formal or informal, but again, everything counts as CPD. Anybody got any questions? Is everyone okay? Yeah. Brilliant. So you can do conferences, you can do e-learning, you can do informal learning, again, like you're just, looking at someone reading a book. But what you need to make sure is get a diary, a monthly diary or a yearly diary or just a notebook. Every single thing that you do, you need to log it properly. So depending on where you work, you'll have a CPD log. It might be electronic, it might be paper-based, but you'll have something there that you can log all of your CPD onto. Now, what you need to do is to make sure that you don't forget things. It's difficult to go on the systems all the time. Write every single thing you've done. So I would write, I observed Athe doing this particular treatment for 3 hours. Then I watched a number of YouTube videos, which took me another 4 hours to do in total over the next 10 days. Then I went online and I read an article, and I read a book. The book took me 6 hours to read in total. So again, there that you're getting about 12 to 15 hours CPD without even realizing it. So log everything down, put down what you did, when you did it, and how long it took you. And now on to the distinction question. Now, on this section, it's evaluate the structure of a named organization in health and social care sector. So for this section, you're just going to evaluate the structure. You're going to look at a particular structure and you're going to evaluate it. Now, we're going to look at the NHS, for example. Now, we've actually evaluated the NHS for you. To save you time, it's a nice idea if you want to use the same system again. If you want to, because a lot of information is here, but if you want to evaluate the structure of a particular care home or a particular service, you're welcome to do that. So we're going to look at the NHS. We're going to look at the initial structure of the NHS, what happened in the later years, what does the NHS look like now, and what is devolution and how it affects patients and doctors. So when you go on to this, please feel free to come back and read through all of this. I'm not going to read every single point because it'll just be me wasting your time. But I'll go over a summary of what is in here. So what is the initial structure of the NHS? So for the first few decades of its existence, the structure of the NHS had a tripartite system. So it was made up of the following services. So you had hospital services, primary care, and you had community services. Now, medical professionals, these are separate systems. The medical professionals actually wanted these to be unified. So in 1962, Enoch Powell, who was the Minister of Health, responded to this request, and he made a 10-year plan to build a new district, and it was to serve a lot more people that were being seen. Now, when you're doing this, if you remember that image that I showed you on slide 3, that's a good image to add in for here, but obviously we'll go over that later. So what happened in the later years? So in 1980, the Black Report was created. So it concluded that the NHS Foundation, so despite the NHS Foundation, poorer people had a higher infant mortality rate. They were having lower life expectancy. So why was this? What was this happening for? They also realized that they've got advances in medical science, but it was costing a lot more. So when Margaret Thatcher came about, she responded to this by doing a concept of an internal market, which it still happens within NHS today. So the NHS Community Care Act in 1990 gave people the regional health authorities budgets. So a budget was made where you have to keep within that. So what they'll do is they'll put people in competition, hospitals in competition with each other, just to try and improve themselves and to get more budget out of it. So the higher your rating, the higher your budget. The more patients you're seeing, the more budget you're going to get. So in 2003, the Labour government also introduced payment by result. This is where NHS bodies were allocated money depending on how many patients see, like I said earlier. It was more cost efficient, but it also meant that if you're trying to get a lot more patients in, you're going to want a high turnover. You're not going to want to keep them in. You're not going to have a patient taking up a bed for 3 days. So it might have adverse effects where you're actually pushing patients out so another person can come in without them being fully healed or fully seen to. So it could compromise on the quality of care. And then we just got what the structure of the NHS looks like now. So we've got the Health and Social Care Act, which was introduced in 2012. So it's very big within all of the care services. So it actually reformed the NHS. So it's got a number of services that work within it. So you've got the Department for Health. So they're responsible for funding and policies. NHS England. So this is the umbrella body. This is the people that oversee everything within healthcare, and it's independent. So that it means that the Department of Health can't interfere directly with the decisions that NHS England make. Then you've got the clinical commissioning groups. So they're the commissioning body, they're the watchdog, they're the people that make sure that all the services are doing what they need to do. And they're in charge of about 60% of the NHS budget, so they've got a very big leeway on, people want to make them happy. Then you've got the NHS Foundation Trust, so they provide the care that the CCG, so the clinical commission groups, say that needs to be done. And they also include hospitals, ambulance, mental health, social care, and primary care services. So they've got a nice chunk of services that they oversee as well. And then devolution. Now, what is devolution and how does it affect patients and doctors? So we've got something called the DevolManc, which is a project that is being initiated by the government. Now, it's to do with Manchester at the moment. So on here, they're doing experimental studies. They're really trying to put it together to see if it'll be beneficial or not. So if devolution, if it goes well, it means that services are more aligned with the needs of the specific region. Like I said earlier today, that depending on which area you're in or what the needs of the residents within that area are, that's how the services are going to be catered. So if you've got a high obesity rate within a certain area, your service will be focused on that. If you've got a high diabetes rate, again, it'll be focused on that. So what they're trying to do is develop a service which is more aligned with what your region needs, what the population actually needs. Now, there are some worries about devolution. It means that it might complicate an already complex system, and it might distract from basic care. So there's pluses and there's minuses. It's nice to think about having a, implemented personalized care for a particular area, but it might detract from other services if too much money is going into it. So what you're going to do here, for 1D1, you're going to pick an organization. So it could be a care home, it could be NHS, Bupa, GP surgery, it can be a particular service that you're familiar with. Include that organization chart on slide 3. And again, I'll create a document with all the images in and I'll label them so you know exactly where they need to go. And then tell me about what services this organization provides. So go through a bit of information. Now, to save you time, I always suggest pick the NHS. You've got a whole load of information that has already been done here for you. You just don't copy and paste it, but do look at the information and include a few points in and do a bit of research extra and then add it in. Now, one thing as well, when you're doing evaluation questions, anything that says evaluation, make sure that you put your own judgment in. So tell me what you think. After you've answered the question at the end, and add one paragraph and tell me, do you agree with what you've written or do you disagree and why? Now, this little section here that we're just going to go through is just for, it goes to 1.3. If you remember, we were looking at the roles and responsibilities of different people. Yeah, so we've got psychologists here, we've got schools here, so just a few organizations. So you're going to psychologists, they counsel children, they provide evaluations, they provide recommendations. Hospital services are there if there's any signs or symptoms of abuse and neglect. Now, when you go in, and I remember taking my son in a couple of months ago, he needed to have his appendix removed suddenly. And the first thing they asked me was, are you in the care of social services? And obviously I was like, no, I'm not. But it's a thing that needs to be asked so that they're aware of who they can get in touch with and maybe they can look into your file. So it's nice to be able to have them there to keep an eye on vulnerable and young people. So they're conscious of people who visit hospitals. So you might have gone into North Manchester today, but then you might go into a hospital in Bury or Salford later on. So it really, or you might go to Royal Infirmary. So it really, they'll keep an eye on where you've been and how many visits you're doing. Pediatricians, I didn't say that right, pediatricians. So they examine children who they think might have been abused. The pediatricians are there to actually look after very young children anyway. But other services that they'll do is they might identify medical needs. They might have to go into court to care proceedings. They might gather and collate information and present it as evidence. Then you've got midwives and health visitors. So they're there right at the beginning, and they identify any risk factors during your pregnancy, birth, and early years. They'll see if there's any people that are at significant harm. Then they'll also monitor the children's development as well. Mental health services are there to carry out assessments. So if there's any sort of risk to a vulnerable person, or if there's any issues within the family, they'll carry out a assessment, and then they'll get in touch with the social care workers or anybody that is necessary in that aspect. Educational services, now they're there to predominantly safeguard young people. Now, within school services, I've worked within schools for a number of years. Too many to be counting, but there's many times where I've been approached by children who have come up and they've say a particular comment to you, or they'll tell you something, and a lot of identifications happen within the school services of safeguarding issues, and it's your job, the people who work within education, it's their job to get that addressed. So they'll liaise with the safeguarding officers, they'll get in touch with social services, and may even act within courts if necessary. Police, again, you've got a duty within those. So police are there to if there's any social services, or if there's any offence against a young child that's been committed, they'll come on and identify it, and they'll come and check it out. NSPCC is a charity, so they've got a number where children can actually call and make anything that is worrying them they can talk about. So they've got a child line. Now, if there's an issue where it's confidential, but if there's an issue where they're really worried about somebody's safety, they will get in touch with social services and the police. And then we just got child protection inquiry. So these are social services, police, and NSPCC who work together. So that's it from there. Let's turn this off.